Um, Good evening, Foxians, and to all of you who have joined tonight for this 157th episode of Gyan Pravah podcast series, the flow of knowledge that continues to flow with all the knowledge that we gather with every podcast. This is the podcast. This idea is the innovation of our dear dynamic president this year, Dr. Sunita Tandulwadkar, who I have no words to express the amount of projects that she's come up with. With spirituality to start off in her Arogya Yoga Yatra, there has been a multitude of projects almost every week where the idea is to get Foxy and her Ghar Foxy, and where we are trying to imbibe and inculcate all the objectives of Foxy. And one thing I must talk about is Sampurna, which is the project very close to our heart, which has created a movement now in Foxy, where we are doing aspects about preconception care, different aspects of women's health. We were touching not only gynecologists, not only healthcare professionals, but all the paramedics, the staff around, the people who are involved in day-to-day activities. I think that has been exceptionally great, madam. Thank you for this. And thank you for this podcast opportunity for all of us, all we chairpersons. We are becoming at ease with every podcast that happens, and with illustrious and renowned faculty, we are getting to be more confident about doing this podcast and managing it. So thank you once again for this opportunity, welcoming you to give the welcome address and bless this podcast.
Thank you, Sita. Thank you so much. You always come out with a fantastic faculty, and the dialogue happen between both of you. Always, I enjoy the way you conduct your podcast.
Thank
Nikhil, this podcast was for the committee chairperson. I thought they are future leaders, so they will be able to take anyone, academic or non-academic background, Indian or international. Maybe there are, Nitin Gadkari se leke film actresses. It's such
you.
a fantastic dialogues they had. Politicians, many they had. But most important thing I felt was I evolved listening to all these people. More than my chairperson, I got benefited. 150 plus faculty interaction, listening to them. There is so much in the world people can do, and it's a great learning experience for myself. This is my committee chairpersons who are working non-stop. Means our Sampurna project on over one weekend, there were 20 faculty in 5 direction, 5 Sampurna happening. I think Sita went to East India after finishing in Calcutta last weekend, and she was in corner of East India. I'm so glad that we are reaching especially to the sea societies. The societies which are not yet formed will be declared in September. My team has already reached to them. And I'm thankful to them because Foxy president can dream, but these cabinet ministers are the one who take ahead. So thank you, Nikhil, for coming on a Foxy platform. It's honor to have you, and I'm sure you are a great orator. You have a huge knowledge about the subject, and this podcast will bring too many attendees with it. Thank you, Sita, and I wish you all the best.
Thank you. Thank you. It's
Thank
always
you.
such an honor that Madam joins us with every episode, wherever, whichever corner of the India she is, or even abroad, I must say. But thank you so much for joining and blessing us.
And today, since it is a Foxy platform, I have Foxy past president with me, Dr. Jaideep
Hello.
Malhotra.
Hi.
She is going to say hello. And to all, I do have even Dr. Narendra Malhotra here. Hello,
Good
hello.
evening,
Oh,
sir.
hello, sir.
Great to be with everyone. They
Thank
both
you.
have been on this podcast before. I'm sure with the multiple personalities and multi talent, they will be. But Nikhil, today it's your day with Sita. I will join the viewers link and enjoy the dialogue between both of you. Thank you for taking out your time. Thank you.
Thank you. Thank you so much, ma'am.
Bye,
Thank you.
Sita. Bye.
Bye-bye. Bye-bye. So, as Madam said, today we are going to be talking on something very different and something that combines law and medicine. And today we have none other than my good friend, Dr. Nikhil Datar, who our topic for today is fetal rights versus reproductive rights, navigating the autonomy in fetal medicine. And I, as the chairperson of the Genetics and Fetal Medicine Committee, will continue this conversation with Nikhil Datar, Dr. Nikhil Datar. So, as we've said, that as advances in fetal imaging has gone up, there are certain questions today, and that is what Dr. Nikhil and myself will be conversing about. But before that, I would like to introduce my dear friend, who's a distinguished senior gynecologist, a law graduate, and a dedicated health rights activist, and he possesses a remarkable track record in both the medical and legal domains. I have seen him, we've worked together, and from there he has come a long way with a wealth of experience as the medical director and senior gynecologist at the Cloud9 Hospital, Mumbai. Dr. Professor Datar has made significant contributions to healthcare. As an honorary professor at Maharashtra National Law University and an ex-head of unit at R.N. Cooper Municipal Hospital, he actually bridges the gap very effectively between medicine and law. Dr. Datar strongly believes in death with dignity. He's one of the first persons in the country to file his advance directive. And his public interest litigation in Bombay High Court on citizens' right to death with dignity has brought radical change. And we are so proud that on 17th of April 2025, Bombay High Court gave a historic decision to create mechanism of passive euthanasia protocol in the state. I hope the other states follow suit as well. So Dr. Datar's impactful legal case, which was the first of its kind, Dr. Nikhil Datar versus Union of India, I remember we'll talk about it, led to an amendment to the MTP Act, which we all are so relieved about, and it opened doors for almost more than 300 women seeking court permission for this very traumatic procedure, which was beyond 20 weeks, all on a pro bono basis, of course. His accolades include a prestigious fellowship from the International Federation of Health and Human Rights Organization in 2010, a Commonwealth Fellowship from the UK in 2009, where he worked on patient safety, and the Mehman-e-Watan Award, I love that name, Nikhil, from the Sindh government, Pakistan in 2006 for his contributions to healthcare. Dr. Datar's multifaceted expertise, coupled with his unwavering commitment to healthcare, which continues even now, patients' rights, and legal advocacy makes him a very distinguished and sought after speaker at conferences and podcasts worldwide. Thank you. Thank you for joining. And, I'm feeling so much at ease with you today because, we've known each other for very long. And it's going to be a more friendly conversation, but more meaningful, of course, with the amount of work you've done. So, firstly, thank you for all that you've done for women's health beyond obstetrics and gynecology.
Thank you so much. Thank
Thank
you,
you.
Sid.
So,
First of all, I really want to thank you for giving me this opportunity.
thank
In general, I have seen that on the Foxy platform, okay, people who are not necessarily into the Foxy's committee or into the office bearers list, if they are independently contributing to the cause, they are generally not appreciated and generally they are not given any importance. And that has been the story with me as well in the past. So I am particularly very happy that from the platform of Foxy, people are slowly recognizing the contribution that I have done. Of course, that has been done in my individual capacity. I have not done it as a Foxy chairperson or Foxy office bearer. I have done it just because I felt that women should have
You're
reproductive
passionate
rights. Who
about it.
better than a gynecologist,
Thank
who can stand for it. But that's what has been my story, and that's what I am here for to discuss today in this podcast with you.
Thank you, Nikhil. So, I don't know, I mean, many of you all might not know that the attendees that we worked together. I think it was long back, and there we were as students learning obstetrics and gynecology, trying to pass our exams. But just tell me, then over the years we went our own ways, and then I realized Nikhil is doing great job in medical law. So what made you feel that transition? Because a lot of us think about it, but
Yeah.
actually not, take the chance, Arey, hamara practice hai, those sort of things. So what made you was it any particular event?
So I think because of being a gynecologist, I think first of all that idea of doing something around ethics and law probably came into my mind, because as we know that we particularly as gynecologists, automatically are judges, because
Yeah.
we keep balancing, the mother and the fetus on each side, and that balancing act is done the best by a gynecologist. So we do definitely become judges just by virtue of the fact that we are gynecologists. Yeah.
Yeah.
And as we know, I mean, gynecologists are the most sued community. Gynecologists are the ones who come in tandem with most of the maximum amount of health laws get applicable to gynecologists. But my reason for me taking up law, I mean, so I was always interested, but you always require one instigating factor for actually doing something, and I'll make it very short. So in 1997, when I started my own practice and I started my own nursing home, just in about 15 days later, there was a incident that happened where some news came in newspapers saying that my nursing home was raided and 50 lakhs rupees brown sugar was found. Okay, when I had nothing to do with it, means not even the building, forget my nursing home, not even the housing, not even the complex
Complex.
perimetry was involved into it. Something which happened on the road, and it was just a mistake actually of the draftmans, who kind of drafted it in a very wrong manner. And that was the first time when I realized, because when I went to the editor, the police came along with me to the editor, explaining to them that, well, this man has got nothing to do with this. We have never entered his premises only in the first place. How come have you written about it? And the editor said that I'm very sorry about the mistake that took place. I am willing to touch your feet and all that stuff, but I am not going to write anything as an apology in the newspaper, because our reputation is at stake. So we
Wow.
cannot write it like that. But I am very sorry with what happened. And that was the first time when I realized that we as doctors do understand, and we feel that we understand a lot, but we are absolutely dumbos as far as non-medical things of the story are
Very,
concerned.
very true. We are
And
so lost in our, tunnel vision of doing
absolutely,
medicine.
total tunnel vision. So then I decided that I want to study law, and in a span of like 6 months, I enrolled myself for the LLB course. And a lot of people are under the impression that there is something called as medical law or something like that. It's not like that. I mean, of course, you can do those diploma, medical legal diplomas. A lot of organizations do symbiosis, and a lot of other organizations have these courses. But what I did was a proper LLB, so it's like exactly what any other person who becomes a lawyer or an advocate does. So it's a 3 years course with 10 subjects each year. So likewise, you pass 330 subjects, and after 3 years, you qualify to become LLB, and that's exactly what I did.
Wow, fantastic. That's so inspirational. And this was with your practice going on side.
Fortunately, it was a early practice days, so less
Yeah.
patients,
True.
more free time. So
Yeah. And that's the
I
best
managed
time to
attending the
imbibe,
course.
a
Yeah,
lot of us were pursuing endoscopy, infertility, those sort of
yeah,
areas. But this is something that has helped a lot of us. So, and I think you were sort of one of the leading persons in this. After you, many people thought about it, we could be
true,
done.
true.
So, yeah. So coming back to our topic as such, when we're talking about fetal rights, you know, let's today I was reading the paper in the morning, and I saw a case in Delhi High Court that they have said that this lady is a rape victim. She's 26 weeks pregnant. She wants to abort her pregnancy because she doesn't want to continue it further, but the court has actually denied it. And they have said, getting the baby now is premature. The baby will not survive. And but if you let it go till 34 weeks, and then the baby at least will be in a state to be adopted or whatever, in a better state to be done. So, and this lady obviously is a young girl who cannot continue the pregnancy any further because of the trauma and everything, and now she's diagnosed. So when does fetal rights actually begin? I mean, where do we put this line forward, and where do we stand in this? I mean,
So it is, to be very honest, I mean, we as students of science, okay, there is a concept of viability which is stuck into our heads. Okay.
yes,
Now, viability does not mean that the rights get accrued. Viability only means, see, if you see the definition of viability, what does it mean? It means that there's a possibility of survival beyond a certain weeks of gestation. Okay. Possibility of survival doesn't bring rights.
Hmm.
Okay, rights is different, possibility of survival is different.
So is
Now,
there something called fetal rights? I mean, okay.
they, in my understanding, the Indian Constitution does not recognize anything called as fetal rights. We consider, so I will go back to the basics of law. If we read the definition of person in the Indian law, okay, then you have person who can be male, female. You can have two persons, two types of personalities or persons. Company is a person,
Okay.
unborn is a person, subject to unborn being born alive on the earth. So, when do the rights of being a person accrue? Only when born alive. So, till the time you are not born alive, you are just like any other appendage to the mother's body. The way today, if a pregnant woman's appendix is to be removed, appendix does not have independent rights of survival. Similarly, the fetus does not have independent rights of survival. Fetus is a character, is a living being having a potential of getting independent rights, subject to being born alive. As long as fetus is not born alive, and that's why we have, see, that's exactly why it is very important that the science has crafted these words. When intrauterine, we call it as a fetus. When born alive, we call it as a newborn child, whatever you want to call it as. We unintentionally keep on mixing using these words. We say baby is like that, baby is this way, that way. It is not a baby, actually it's a fetus. So that distinction, and funny part of the story is that even if you look at various languages, not only English, even if Hindi language you consider, then garb in Hindi is unborn. And when somebody is born, then you call it as a bacha, whatever you want to call it as. So there are distinct words. Even in common language, there are distinct words. So that means there's a clear distinction between an unborn and somebody born alive. And I'm not only talking of this from the Indian perspective. If you pick up the ethical guidelines, so there is Nuffield Bioethics Council guidelines, okay, which come from UK. Now, this is a very prominent, and you have studied in UK, so you know the importance of Nuffield Bioethics, because that's a body which whereby ethicists,
Follows.
lawyers, doctors, common people, a lot of people contribute to that. So they have very clearly said in their report, and report is available on Google. You can just simply download that report, Nuffield Bioethics Council guideline. It says that the visible point of transition of rights is live birth. So I'm quoting this sentence exactly from that report. So
Verbatim.
even in the UK, the ethical guidelines say that rights accrue only after being born alive. And that's precisely why whenever many medical organizations, Foxy or otherwise, when they craft conference headlines or conference titles as fetus as a patient, okay, I
Hmm.
have a strong objection to that. Mother is the patient, fetus is not the patient directly. Fetus, by virtue of being a part of the mother's body, is a fetus,
Is a
is a
fetus.
patient. But independently, fetus is not the patient. And fetus is never a patient independently. Being a part of mother's body, the fetus becomes your patient.
Okay. Okay. So, as you write, so you said there is no clear, I mean, there is a definition that is only when the fetus is born, then it starts, right, starts there, and this is, across
So,
all
in other words,
across the
what
world.
I mean to say is that even if a 24-weeker severely premature baby is born, the rights accrue of survival, and hence you have to resuscitate it. If an anencephaly baby is born at full term, even if you so rights accrue. Now, since there is no scope for treatment of anencephaly, you can withdraw the treatment because there is no scope of treatment.
Yes.
But rights accrue. Why? Because there is a birth
By
which happened called
by virtue of birth. Yes.
yes, by virtue of birth.
By virtue. Okay, that is very clear. Thank you. So, we don't face this rarely, but of late, recently rather, but not very recently, I would say, a lady, she had, she was having distress, and the baby needed a cesarean section. So can we,
No,
can we? No, that is exactly. I mean, we are advising a cesarean section, and she said, whatever it is, I will not, do a cesarean section. I want to have, be it in the interest of the mother or the fetus.
You have no privity of contract with the fetus, bypassing the mother. Your patient is the mother. Mother's consent is required. Without mother's consent, you have no privity of trying to do something to save some unborn or something like that. That is not what you may see. You may go to some cases have happened in the past. Somebody has gone to court somewhere here, they're not here, in abroad and all that kind of
Yeah,
thing.
exactly.
But prima facie, your privity of contract, doctor patient relationship is with the mother, it is not with the fetus. Through mother, it is with the fetus, but
True.
not bypassing the mother.
Right. So, I know of a doctor who's actually, because sometimes we as doctors tend to play God, and we tend to say that, this will not, this will be very bad for the fetus. You have to terminate it and everything. But miracles happen, and then the fetus actually becomes a child, and everything goes on. I know of a doctor who's actually, had a spine, the parents opted not to terminate, and he's had bladder surgeries, he's had spina bifida, and he's working, so that sort of a thing happens. So sometimes we are trying to act God, and we try to push things, but obviously it depends on the mother what she wants to do at the end. But regarding your interventions in terms of your contribution in terms of this amendment of medical termination of pregnancy, I remember in Kolkata itself we had a case of a fetus having a cardiac anomaly.
Third case in 2018. I mean, that's how the whole journey began, was because of Bhaskar, because it was your and Bhaskar's patient and that doctor's daughter or somebody.
Yeah,
And
yeah,
we had Dr. Devi Shetty coming up and giving opinion. And that's how we got the permission to terminate the pregnancy. That was the case where the myth that termination of pregnancy can only be done if the pregnancy is laced with non-viable complications. That myth got busted because
absolutely.
till then we had anencephalies, we had bilateral renal agenesis, where we know that survival is zero. They are incompatible with survival. But this was the first case where, by virtue of having a cardiac abnormality, though very complex, there was always a possibility of trying to do surgeries and all sorts
Multiple
of things.
surgeries, quality of life getting affected.
So the quality of life and hence termination, that concept came into picture, and that concept was accepted by the Supreme Court. And
Absolutely.
Justice Dhananjay Chandrachud went ahead and gave that judgment. Beautiful one, was courtesy Sita and Bhaskar.
Thank
So
you.
thank you for bringing that up. I mean, of course, I was involved in actually
Yeah, I
drafting
was
the
just
whole
going to
thing.
say that you were the prime, who sort of led the whole thing, initiated it. And I think at that time we didn't have any medical board. We had to go to court, and that is when the concept of medical board came up, and of course
And one funny part of the story is, if you read honestly, I mean, if you read even 1971 law, 1971 MTP Act, MTP Act has never said that it is only limited to in non-viable pregnancies. They have said that if there is a substantial risk of physical or mental handicap,
gap.
then termination of pregnancy is to be done. So they also, means in 1971 also nobody said that it is only limited to non-compatible with life scenarios or something like that. They just said anything which is serious,
True.
you can go ahead with termination of pregnancy. So that concept, lot of gynecologists and even non-gynecologists have that concept that MTP can only be done for non-viable scenarios. But that's totally untrue. That was never there. Right from 1971, that was never there.
Yeah, I think the interpretation was different at different places, but yeah. So, regarding this sort of, especially nowadays when we are with advances in ultrasound and we're getting to diagnose things earlier, I don't know if it's a blessing or a sort of bane or a boon for the parents, whatever it is, but obviously it is very important that we diagnose this, and the early we diagnose, we sort of do. Sometimes it evolves late. Now, the aspect of this, termination, like if a medical board approves it, we are very happy that even after 24 weeks, even if there's no limit, if there is a problem, we can terminate the pregnancy. But the question is, I recently had a case where there was a genetic issue, Okay, and the patients went to a medical college because it was diagnosed at a private hospital. They went to a medical college and they asked for a medical board there. And they said, okay, yes, you can have the termination, but you provided you have the termination there. And the patients being affluent, they didn't want to get it done. So how does this work? So that is something,
So I'll
and then
explain. Yeah,
let me finish this question. So they
yeah.
didn't want it. So I said, okay. They said, then we said, okay, you go to another medical college. Somebody advised them, you go to another medical college. They will allow you to go and get it terminated at your hospital. Okay. So they went there and then they apparently actually the condition was not that serious. It was not like anencephaly or something like that. It was some complex genetic condition which different people had different interpretations of it. And when they went to the other medical college, they did a medical board and they decided it doesn't need termination. It doesn't. So the whole picture changed. And by then she was already 28 weeks. So she came back. So with all that, she continued and the baby is doing fine now. So my question is, why does it differ from medical colleges to medical colleges in the own same state? And why is this rule of, having to terminate, is that what it is? What I want to know from you.
So, so prima facie, I mean, I mean, typically lawyers have that kind of an understanding. They frame the issues first. They first frame the questions, okay, and then they answer the questions, right? So basically, I will frame the question. You can confirm whether I've understood rightly or no. The basic question that that I need to frame here is that once beyond 24 weeks, can a can a hospital terminate the pregnancy beyond 24 weeks, though allowed by the board?
Yes.
This is at a government hospital,
Yes.
right? It's the basic question.
Absolutely.
This question I have handled in about 3 or 4 scenarios after 2021. And you can even read the judgment Manisha Patel and Nikhil Datar versus Union of India. So this was a typical case where a woman came to me. She was 24 plus weeks of pregnancy. Same story what you told me. Multiple congenital cardiac abnormalities, affluent condition. Came to me at Cloud9 Hospital. We sent her to JJ Hospital. JJ allowed termination. The woman said, I don't want to terminate at JJ Hospital. I want to terminate at Cloud9 Hospital. Funny part of the story was JJ also wrote that, oh, yeah, you can go wherever you want to and get it terminated. Okay. Patient came to me saying that, look, JJ has said termination, yes, and JJ has said terminate wherever you want to terminate.
Wherever
There is
you.
no problem. Okay. Now patient was sitting on my head that please terminate the pregnancy at your hospital, that is Cloud9 Hospital. Okay. Prima facie, you find nothing wrong. In fact, a happy situation. Even government board is also saying terminate wherever you want. But the truth of the fact is, how we will analyze and how I analyze this question and how what I did, I will explain to you. I am sitting at a private hospital. Okay, what is the license that I have in my private hospital for terminating the pregnancy is 20 weeks, which is to be now read as 24 weeks. So my
Normal
hospital is,
MTP
yes.
license.
So my hospital is allowed to terminate the pregnancy up to 24 weeks. Am I allowed to terminate the pregnancy beyond 24 weeks? By the license, no. Okay. Next question. Does JJ Hospital, which is a government medical
Hello?
college, hello, am I audible? Hello?
Hello?
Am I audible? Hello?
Hello?
Hello, am I audible? Hello.
Yes, sir, you are audible to me.
Hello?
I think Sita is not able to hear me.
Yes.
Yeah,
Sita ma'am is not able to
yeah,
hear
yeah.
you. You are audible to me.
Okay. So do you want me to continue because probably the audience will lose the link, or you want
Yes,
me to?
yes, sir. You can continue.
Yeah.
You continue with
So
your answer.
yeah. So but then, oh, I think we have lost her. I think we have lost Sita. Okay. So the question was that. Sorry, where was I? Yeah. So is the license telling me to terminate, allowing me to terminate beyond 24 weeks? No. Is the medical board, which is from the state government, it's a prime institute in Mumbai, JJ Hospital, they are not having any objection. But then the question is that do they have the authority to allow me to terminate the pregnancy or allow a hospital to terminate the pregnancy which does not have a license beyond 24 weeks? And answer is, we everybody knows that no hospital has that kind of an authority. The license, you get the license from or approval from the district committee, and you have to apply to the government under Form A, saying that I please allow me to terminate the pregnancy. I want to seek or obtain license to terminate the pregnancy up to say 12 weeks or up to say 24 weeks or whatever it is. It means that the way the form, hi Sita, welcome back.
Sorry, yeah.
So I'll just make it very quick for you to understand. So the question was, can I terminate the pregnancy in private hospital? I have a license up to 24 weeks only. Okay.
Yeah.
Now, next question. Though JJ has written that you can terminate wherever you want, does JJ have the authority to give me that kind of a permission to terminate when my license is only up to 24 weeks? So we have to go back to MTP Act and the rules thereunder. And we know that we are supposed to get the permission back from the district committee, not from JJ hospital. No medical college has the authority to decide on that, right? So we are supposed to fill up a form, Form A, in which there is a column. Do you want to seek permission up to 12 weeks? Or you want to seek permission up to 24 weeks? Okay? Are you with me up to here?
Yeah.
Now, unfortunately, after 2021 amendment, this particular form has not undergone amendment.
Okay, so that is a big loophole there then.
Yeah, so form continues to say up to 12 weeks or up to 24 weeks, right? So what I did was, I, along with the patient, went to High Court. I filed a writ petition. I brought this to the notice of the judge. I said that, look, I am also equally competent, capable, infrastructure is sound, etc., etc. Patient wants to terminate the pregnancy with me. JJ has allowed termination, but my difficulty is that I don't have a license beyond 24 weeks. And I cannot obtain license beyond 24 weeks because there is no scope for me to first of all apply.
There's no separate provision for that.
Form which is deficient.
Yes.
Now, once the judge came to know about this, judge, the union government lawyer and the state government lawyer all agreed that we don't have any intention of curbing the access, only allowing government hospitals to do, not allow private institute to do. We don't have any such kind of an intention. We understand that there is a fallacy, there is an unsolved problem, unresolved problem with this form which needs to be rectified. And the Bombay High Court gave an official order to me saying that please go ahead and terminate this pregnancy at Cloud9 Hospital. And we did a termination of pregnancy beyond 24 weeks at private hospital after doing feticide because she was about 24 weeks. But with the official court permission, my petition is still continuing to lie because my next prayer, one was to allow me to terminate, second prayer is to make change in the form. And behind that, there have been 3 such kinds of cases. In all 3 cases, I went to the court, I have explained this particular thing, seek permission from the court, terminated a pregnancy in my hospital. Now, this prima facie doesn't mean that this automatically changes the law of the land. Please don't misunderstand it that way. It only means that court allowed us to do so in those cases because they have repeatedly allowed that. I mean, it's kind of, you can say that, well, it's like paving way towards making change and change to the form. But ultimately, unless and until the court directs the government, which court has already directed as a matter of fact, but ultimately when the forms gets changed, we should get the third category beyond 24 weeks. And I would say that for beyond 24 weeks, much more stringent criteria should be there. You should have those hospitals where 24 hours, availability of RMO, blood bank, ultrasound facilities. So lot of infrastructure needs to be there when you are terminating the pregnancies beyond 24 weeks because safety is very important. We don't want any nuke and corner wala nursing home terminating beyond 24 weeks and causing more trouble. But you cannot prima facie just simply stop private sector from terminating pregnancies beyond 24 weeks. I mean, that's probably not the way to take it from there forward. Or other alternative could be that you set up medical boards in private hospitals.
Yes, that is what my next question is. What that why can't we do that in the same
Now that's up to the government to decide
government,
what they want.
obviously? Yeah, yeah.
In Delhi, for example, Apollo Hospital in Delhi, okay, is a private board for termination of
So it
pregnancy.
differs from state to state, isn't it? As
Exactly. Exactly. Now, since MTP, some part of it is a state part and some part of it is a center part. Okay, there are some states who have taken this particular avenue out. So, if Apollo Hospital in Delhi is supposed to be the board, people can approach that board, seek permission, and get termination done at Apollo Hospital there itself. So, it automatically solves this problem. But if at all that's not happening, say in Maharashtra for that matter, only government hospitals have the board, and
even
there
for
will be a lot of
West
patients
Bengal,
who will
yes.
want to do termination at the government hospital, but they will have to come to people like us. The only difference is because I know the law. Okay, I don't prima facie get kind of carried away. Oh, JJ has told me, so I can go ahead and terminate the pregnancy. No, no, you are totally wrong. JJ has no authority. Board has no authority to authorize your place for termination of pregnancy. They are only saying that this case is fit for termination of pregnancy. That's the only authority they have got. They don't have authority to authorize the place of termination.
So, tell me if I'm wrong. So, in that case, even in our state where we don't, where the medical board gives, if the medical college gives the permission, we are not authorized to actually do the termination.
But take my judgments, go to High Court. I can help you. You will get judgment in 2 days. Because there are three cases from Bombay High Court, and it's very evident, that it's a fault on the side of the government of not making changes in the form.
Yeah, yeah. Because I remember that patient, the first patient that we did, that was a special case. The court had
No, that time the law only was not
was not
applicable.
there. Exactly,
There
yeah.
was
And
no
so
law
right
only.
now, with whatever amendment we have, this is a big loophole that needs to be covered, where the reproductive right of the mother is sort of, hampering.
Basically, High Court is above the law. High Court and Supreme Court is above the law. If High
Yeah.
Court allows, then there is no question of what does the law say and all that. Where law ends, the court starts.
Right. So, but if obviously when it comes now to the important question of, where if beyond 24 weeks there is a risk of the fetus being born alive, so we do a feticide with KCL injection, where can that be done? And do we have to fill all those forms for this, specific feticide from the law part of it?
So first and the most important question is that should we do feticide or should we not do feticide? That's first question.
Okay. Is
Okay.
there any doubt in that? Is there any question?
So a lot of people have these questions. No, should you do feticide once you're terminating beyond
I know,
24
yeah,
weeks?
yeah.
In the olden days, there have been cases where people, oh, we'll have to do feticide, otherwise fetus will be born alive. That's why we will not terminate the pregnancy. I mean, there is no sense in this, but that's what has been the scenario because it's a evolving situation. Our gynecologists only are confused, first of all. Forget
Absolutely.
about non-gynecologists.
Yeah.
See, I will just digress from here, but let me explain to you something very, very important. Okay. Look at the constitution of our medical board under the law. Okay, what does it say? You need one gynecologist, bare minimum, one gynecologist, one pediatrician, one
Pediatrics.
radiologist, right?
Yes.
3 people, minimum 3, and many more after that. Now tell me one very basic question. How many of these members fulfill the criteria of RMP under the MTP Act? There is a difference in the definition of RMP under MTP Act and RMP in general. What is an RMP under MTP Act? RMP under MTP Act is not only having registration with state and blah 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 and all that, but RMP under MTP Act is that person who has experience qualification in OBGYN, at least done 6 months post, DGO, MD, MS, whatever that is there. That person qualifies to be RMP under the MTP Act. Do you agree with me?
Yes.
Now he's a radiologist RMP under MTP Act. He's a pediatrician RMP under the MTP Act. Now, if your medical board is having 2 non-RMPs and 1 RMP under the MTP Act, then what kind of performance do you expect from that board? people who are sitting in the board in majority have never ever performed MTP. They don't understand MTP. With what confidence are they going to give you the verdict for MTP? Now, I am not saying that they are not important. Of course, they are important.
No, their
Radiologists are
views are
diagnostic,
important.
get
Yeah.
that. But ultimate decision on MTP is to be taken by whom? By gynecologists. So you can have a committee of 3 gynecologists. They are all RMPs under the MTP Act. They can decide about whether to terminate the pregnancy, what methodology, and what not. But if you are one bichara gynecologist and overpowered by all other people who don't have any no knowledge, no nothing about MTP, what kind of judgment do you expect from that board? Acha, funny part of the story is that if you look at the way the whole board is supposed to give opinion and all that, okay, do you require to give reasoned opinion? No. You have
No.
to say yes or no. Do you have a mechanism of challenging that? No. So it is very easy for the board, more particularly from government sector, to say no. Na? Why to say yes and get into more
There are
trouble?
problems. Yeah.
So simply say no, it solves all the problem. Nobody is questioning anybody for that.
Yeah, that is the problem. Nobody can challenge anything. It's
Exactly. So that's the story regarding the board, right? Now we come to the feticide. Is there any way by which I can share the screen?
No, I don't think so. No.
I can see a share button. Can support team
Yeah,
help
you
us?
can.
Yes, sir, you can share.
Yeah, you can share. I can see. Yeah, you can. Go ahead. Thank you. That will be very interesting.
Let me see. One second. No, I am just straight away going to show you actually the sorry, one second. The GR only. Where they have clearly said that you can go ahead and terminate the pregnancy. I mean, you can do feticide. One second. Let me try and figure that out.
And this PT side obviously can be
Yeah,
done
yeah, yeah.
wherever
I'm going to show
trained
you about
center.
feticide
Yeah.
only.
Yeah.
I'm going to show you about feticide only. Okay. Can you see my screen?
Yeah, we are beginning to see. Yes.
Now, this is the letter, okay, which the government of India has actually submitted to the Supreme Court in my case, Nikhil Dakar versus Union of India.
Right.
Okay, this is the GR which government of India has submitted. Those who are interested can check this DO number and all that stuff, and they can find out this copy of GR from wherever they want to find it out. Okay, now this was submitted to the Supreme Court.
Right.
Now, I will take you to something called Guidance Note for Medical Boards for Termination of Pregnancy beyond 20 weeks. I mean, this was way back in 2017, even prior to the amendment of the MTP Act, at which
Yes.
I used to go repeatedly to the court after 20 weeks. So that's why beyond 20 weeks. Okay, this is a guidance note created by the Ministry of Family Welfare for whom? For the medical boards for termination
Beyond.
even at the state of pregnancy.
Yeah.
Okay. Now, this is the whole thing, okay, all together. This is all the narration and everything. And now I'm going to straight away take you to some very important things. Can you see this 5C?
Yeah.
Stop.
Stopping fetal heart rate. Yeah. Heartbeat.
In
Yeah.
case of pregnancy over 24 weeks of gestation, ultrasound guided procedure may be required that the fetus is not expelled or delivered alive. They have quoted RCOG. They
Hmm.
have quoted 2 to 3 ml potassium chloride. All these things have been quoted by Government of India in their GR, which is submitted to the Supreme Court. Now, is there any doubt still, okay, as to whether one should do feticide or no, whether it is ethical or no, whether it is legal or no, and all that kind of thing? I don't think that there is any amount of doubt whether you should do and whether it is allowed or no. Okay, so it is very clear that feticide can be done in our country once you go beyond 24 weeks. Another thing I want to show is this question which comes into picture all the time, that how do you decide whether this abnormality is serious abnormality or no? because it's a very subjective kind of a thing. Na?
Yeah.
Substantial
Yeah.
abnormality means
Yeah,
what?
this is there, yes.
In this GR, you see this annexure to list of major fetal abnormalities.
Hmm.
And they have objectively given a list of what all abnormalities should be considered as major abnormalities. And you see the
Incompatible.
list,
Yeah.
the list is unending list. Means you can think of an abnormality and you
No,
can find
and very, I have gone through this, and very interestingly, with every organ type or whatever it is, they have said others in consultation with experts. Means that there is a provision that, in consultation with the experts who would think that this, like if even if it's a cardiac abnormality, if it requires multiple surgeries and those sort of things, that has to be decided by the experts and the family together whether they are able to withhold with
this has
sign.
very exhaustive GR. Okay,
Absolutely.
and even in the Bombay High Court, one question that came up in one of my recent matters. So technically, at this point of time, just to digress, I have got four writ petitions filed around MTP Act in Bombay High Court. One was about feticide. Second was about private hospitals doing MTPs beyond 24 weeks. Third was about the POXO and MTP, I mean 16 to 18 age group, and
Yeah.
that's something which we keep on talking about it. I am happy to inform that in few days that problem will get solved permanently for the whole of the country, because the High Court told me only to write a guideline and submit to the government. Okay, so I have written that for age between 16 and 18, what kind of
That gray zone. Yeah.
so, and fourth is about directing the government to include unmarried non-rape victims or non-rape pregnant patients, unmarried. So, in short, failure of contraception as an indication for termination of pregnancy between 20 and 24 weeks. Currently, it is only up to 20 weeks.
Yeah.
So even that problem will get solved. So four
Oh,
writ
great.
petitions
That's
are pending,
fantastic.
and it will solve most of these problems down the line. So, anyways, coming back to the original topic, I think I can stop sharing because it's not needed anymore. So I think it solves the problem about feticide. Of course, you should do feticide. Now the question is only this: that when you decide to terminate the pregnancy beyond 24 weeks, you should do feticide. That's clear. But should you do termination of pregnancy once you're beyond 24 weeks? Because the law of the land currently says that you can terminate a pregnancy anytime if there are serious abnormalities. So that problem is solved.
That is clear.
But if at all you have a normal fetus, you are restricted from to terminate the pregnancy only up to 24 weeks. So
24.
we have a rape survivor, a minor young girl, 12-year-old girl, so on and so forth. Okay, what do you do for that kind of a situation? That's the main question that we are battling today, especially when the fetus is normal. Okay,
Yeah.
now legally I say that you cannot distinguish or differentiate a differently challenged person and a normal person. So similarly, you cannot differentiate a normal fetus vis-a-vis an abnormal fetus. If abnormal fetus deserves termination of pregnancy, a normal fetus also should deserve can be terminated. Okay, just because the fetus is normal, your focus
Appears
should
normal. So that we say, apparently normal, because we don't know. Nothing is 100% and 0% in
so
science.
so we as doctors see, because here what happens, medical boards have a lot of role to play. A 28-weeker multiple congenital cardiac abnormality, your hands don't shiver when you are doing a feticide. Why? Oh, it's abnormal. For normal fetus, oh, it's a normal fetus. How can we do that? Array, but you cannot differentiate a normal fetus from a differently abled potential fetus. They are both the same. If you are one saying that they have a right to survive, but they have a right, but both have a right to survive.
Yes.
How can you differentiate these two things? But
Yeah.
that a common doctor does not understand. So common doctor writes the report. That report is read in the court. Courts always go by the doctor's reports. If the doctor portrays, oh, it is like, it will become like this and it will become feticide, it will become like that. But then judges say, yeah, you are right, don't terminate, don't do feticide. But last case, when at 28 weeks, same story, but for cardiac abnormality, you never asked the court whether to do feticide or no. That was considered as a part and parcel of your procedure. Why that differentiation in your mind? Because that is ingrained in us as doctors.
True.
Medicine is ingrained in us as doctors. We don't look at it from the ethics or law perspective.
Yes. Yeah.
And then we give those kind of feeds to the judges, and judges continue to. And if nobody's kind of counteracting, I mean, if I am there,
Challenging
I
it. Yeah.
counteract because I
Yeah.
know medicine and law.
Yeah.
I will show this GR. I will say that, well, government of India has approved this. Who are you to stop? But if that is not shown, but then that High Court judgment which you showed just in the beginning, you spoke about, such
Yeah.
kind of judgments are inevitable because you are
Absolutely.
deficient in putting forth the arguments. If an argument is put like this, that you are you interested in 12-year-old girl's well-being, or are you interested in minus 3 months old person's well-being? Where should you have your well-being more deviated to? Who on the earth will answer that no, 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 minus 3 months old's well-being is more important than 12-year-old girl's well-being? But
Yes.
you need to argue the matter in that
You need to
particular.
reason it out well with them, and
Exactly.
yeah, that is the sad
So
story.
I have got a termination order at 32 weeks of pregnancy for a 14-year-old girl, okay, who was a rape survivor. I have got an order for termination at 32 weeks. Because it's the way you will portray, it's the way you will put forth
No,
your
but
argument.
32 weeks is fine. I mean, okay, you terminate, the baby will be born alive, but 32 weeks can be, salvageable. But if it's a 26 weeks, I think it is inhuman to say that you carry the
Exactly.
pregnancy till 32
No,
weeks.
no. So this salvageable business again is rooting from what? Viability.
Yeah, that's what, yes.
You have to answer one simple question. Termination of pregnancy or abortion is done to the mother. Does the mother require termination of pregnancy? If the answer is yes, what is the weeks of pregnancy? Beyond 24 weeks. Beyond 24 weeks, feticide terminates the pregnancy, chapter over.
Yes, exactly.
There is nothing to get into that salvageable nonsense, because that question doesn't come into picture. Because then your cardiac abnormality also. Why terminate at 26 weeks? Give the best possible chance by being born at full term. Chance of survival at 26, 28 vis-a-vis chance at 37. 37 is always a better chance. Now allow them to get born. No, why are you terminating unnecessarily? So that salvageability business has to be out of your head completely. You have to only answer one question: that is termination required?
Yes,
If
that is the
termination
basic
is
question.
required, termination is required. Now, depending on the weeks of gestation, you have to decide the method. Do we decide like that? Okay, termination is required. What's the week of gestation? 8 weeks, 9 weeks. So, medical tablet.
Yeah.
9 to 12 weeks, suction evacuation. 12 and above weeks, whatever procedure you want to give me, whatever, medical kind of a methodology. Do we do like that? Then your thought process should extend exactly in the same way further also,
Yeah.
that beyond 24 weeks termination is required. So feticide followed by inducing the process of separation and expulsion of products of pregnancy from the womb.
Absolutely.
Categorically, I am not using the word induction of labor,
Yeah, yeah.
because again that gives a wrong sense of understanding. I am using the word induction
Expulsion.
of process of expulsion of products of pregnancy.
Pregnancy, yes. So the feticide, I mean, I didn't realize we've run out of time. There's so much. So this feticide can be done at any place, isn't it? And you don't need to fill up forms. I mean, again,
No,
as you
no, so
rightly said,
feticide will be required to be done at a place, okay, which is
where the
registered under
skill is,
PCPNDT Act.
yeah, absolutely. And you don't require to fill up any forms for those reasons because it is not exactly a termination.
You fill up this. No, 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 no,
Usual
wait.
forms, not that.
Okay, so
Yeah.
okay, so I will come to that. Unfortunately, there are a lot. Okay, so all in all, now there are nearly 22 confusions under the in the amended MTP Act. Okay, and that is why I have now filed again a public interest litigation in the Supreme Court, challenging the amended MTP Act and the rules thereunder.
There are a lot of loopholes
Yeah.
there, yes. And so that
So
is
now
why a lot of gynecologists, we are confused and they are trying to, safeguard their interest and not give justice to the
now
patient.
I will come to this very vital point, which is the absolute root of the whole trouble and the problem. If you read the definition of termination of pregnancy, okay, under the Act before 1921, The law never had that definition only. By the way, something interesting. UK has an abortion act. India has medical termination of pregnancy. Why did they not have abortion act as the word? They copied everything from the UK law, right? Why did they change the name? Nobody knows why did they change the name. Maybe at that time they never wanted to get into that controversy of using the word abortion. So they crafted this medical termination of pregnancy, which looks very medical and common people won't understand. Maybe that might be the case. I don't know. But this word medical termination of pregnancy is the word which only appears in Indian context. Nowhere on the globe this word actually exists. Everywhere it is abortion or no abortion. That's it. There's no hanky-panky called medical termination. Now, in 2021 law, medical termination of pregnancy is defined as any medical or surgical procedure to cause termination of pregnancy. That's the definition.
Yes.
Now, let us look at termination of pregnancy. What is termination? Abolition. What is pregnancy? Pregnancy, if you look at the common simple English dictionary, pregnancy is the state of the mother to have an unborn in her body. So, abolishment of the state of the mother to carry unborn in her womb is termination of pregnancy. By that standard, even your induction of labor becomes termination
Yeah,
of pregnancy.
absolutely. Yes.
C-section becomes termination, ectopic becomes termination, miscarriage becomes termination. Ideally, what we want abortion. What is abortion? Abortion is that medical or, and I am quoting this from English dictionary, yeah? All your Oxford dictionary, everything you will see these simple non-medical, non-legal words I am talking about, non-legal and legal dictionaries. Abortion is that medical or surgical procedure which is done with an intention of abolishing the fetus. Now, when your thought process is clear that you are doing the process to abolish the fetus, everything automatically falls in place.
Falls into place. Yeah. Yeah.
But we have ourselves only decided not to answer that question. Okay, so each one of us wants to take this kind of a route. Oh, miscarriage. No, that doesn't come under MTP. Multi-fetal pregnancy and reduction, you people will say, oh, mother is continuing to become pregnant. So that doesn't come under MTP. But then ulta also can happen. No, then technically a delivery will also become MTP if you go by that standard. So this problem gets rooted from the definition itself. But that's why I've challenged the definition also.
Oh,
That what is the intent? The
yeah.
procedure is dependent on the intent, because otherwise what procedure are you doing? If there is a fetal growth restriction and you are inducing labor, the intent is to salvage that particular fetus. If it's an abnormal fetus, you are doing the same procedure, same medicine, same intent, separation of products of pregnancy from the womb. But intent is totally different.
Yes.
You want to abolish that fetus. That's why you are doing what you are doing. So it is the intent which decides whether it is termination of pregnancy / abortion or it is induction of labor / delivery.
Whatever. Yeah.
But this is absolutely lost and not captured in the law, not captured in our heads also as gynecologists. So we are only confused what we will teach other people.
Yeah, I think there are so many questions than answers have got, but yes, it has helped us in a big way by changing, and there are some rights which we need to address, and I think you're doing a great job in that. So we're looking forward to these more amendments in the amended act to come and help us more. But
In my public interest litigation, one of the biggest thing that Foxy can contribute is to join me, because I have been facing a very major problem that they constantly say that there is only one Nikhil Datar, a gynecologist in the whole of the country who has all the problems about MTPI. Nobody else has any problem. And to that, I cannot solve that problem. I cannot give any answer to them. So they always feel like that. And that's why this process happens very slow, because everybody over there says, why only this man keeps on coming? Why nobody else comes? Why no organization
I
comes?
think we're all there. We wanted, I mean, whichever capacity you would like us to help, I'm sure
No,
our
it does happen. Up till now, it has not happened in last 12 years. I hope that the newer people take this up seriously
yes,
and kind of support it. Because, see, ultimately this will solve your and my daily problems. We are facing all these problems every day.
No, but having said that, the amendment has also, the Foxy has had a big way in extending. So that is there, but it more needs to be done. So whichever capacity we can help, as professionals, in the Foxy leadership, I'm sure that can be addressed. So I think one last, we are almost the near at the end, but one message to all our budding gynecologists who would want to do what you are doing. What is the, do they have to do the 3-year course that you've done, or is there a shorter way of doing it? Or
See, I won't
everything is
say.
a quick, fast way?
No, so I continue to practice fully OBGYN. I don't practice law. Law is my hobby. Law is my social work actually. So I don't hold any briefs and I don't fight any cases for any individuals or hospitals. It is not my profession. I don't necessarily want to say that everybody should read law or study law or something like that.
Oh,
But one thing is for sure, the message for all budding gynecologists will be that you need to differentiate yourself in what role you are doing that particular work. When I am sitting as a doctor, I have to be absolutely under the under the law. I should not go and traverse beyond the law even by a minute. More particularly for MTP Act, please try to understand that MTP Act is just going to give you a protection provided you stick to the MTP Act. Any deviation from the rules of MTP Act, whether it is weeks of gestation, whether it is a place which is not recognized for MTP, any deviation from there can land you into a major soup,
trouble.
and it will be a criminal case against you. So when as a doctor you have to follow law to the T, but as a citizen you can make wonders because you are one of those gifted citizens who understand the medicine, who understand the pain points of the people, and who can help the citizen society to make a change in the health law of the country. And that's why as a citizen you should contribute towards making a change to the health law in the country. Because when you talk of any technical subjects and law, you will always find that these laws are very deficient. Why so? Because technical people don't want to get into law people don't understand technicality.
Understanding. Yeah, true, true.
So that gap needs to be bridged, and that's where we all can chip in and play a very important and crucial role, at least to make the people there sitting aware that there is a
Not to
problem
make
which
them
exists.
understand. Yeah, yeah, true.
But we don't want to even make them aware that there is a problem which exists. So that is where the new generation should chip in, I feel, and that might make things safer, not only for our own selves,
All of
but
us, yeah.
also for our patients.
Yeah, absolutely. So thank you, Nikhil, for that wonderful. I mean, I had so much more to discuss. Firstly, sorry, I don't know what happened to my net in between. I
Yeah.
suddenly thought you were lost, but thank you so much. And we're really looking forward to more of your contribution. And as I said, we'll be ever happy to contribute in whatever way we can in our capacity. And it was wonderful talking to you. And all the
You.
best with what you're doing and for whatever you've done so far. Thank you so much.
Thank you, and good night. Thank you very
Thank
much.
you. Thank you.